more than just clean teeth. It can also be a lifesaver if your dentist catches the early symptoms of oral cancer and doctors are actually able to treat it. And joining us to talk about Oral Cancer Awareness Month is Dalyn Rose, a woman who has survived oral cancer at such a young age. Yes. Thank you so much for coming in. And you and I were talking before the show about how they first detected this, and I think this is really interesting for everyone out there.
Yeah, what happened is I noticed a bump on the roof of my mouth for about 4 weeks, and I went into my general practitioner, and I talked to her about it, and we did some blood work, and it all came back really well. However, she did follow her gut instinct and referred me on to an oral cancer specialist and oral surgeon.
Sure.
And they did a biopsy, and the week after the biopsy was done, I got the results, and it came back positive for oral cancer. So what it was is I had cancer of my hard palate. And the following day, he actually had referred me to the Methodist Oncology group, and I met with Dr. Lindau, an oncologist there, and a group of about 4 others. And they went through the plan of treatment and everything else that I would have to do. And I had a pretty extensive surgery in November to remove my hard palate and also 2 teeth on the left-hand side. So the importance is that we caught it early enough because I did have intermediate stage, so it was growing faster at a faster pace. But since I caught it early, I was fortunate enough I didn't have to have radiation or chemotherapy.
And Dalyn, that's the first thing that we all think of when we hear cancer is chemotherapy, radiation, the traditional path. But you actually took a different road, and now you wear a prosthesis, which has been wonderful for your lifestyle.
Yes, without the prosthesis, I wouldn't be able to sit here and talk to you or eat or drink like anyone else. And so what they do is they work with a dental oncologist out of UNMC, and he makes all the prosthesis for them. And they do an amazing job. They actually fit me for one right after the surgery because with oral cancer, you have to have surgery, unfortunately.
It's the only route that is available for you.
It's really the only route. And so with that kind of allows me, and I go in on occasion to kind of get it fit because otherwise I have a hole in between my nasal cavity and my mouth, and so I can't talk.
And you said that hole's actually about the size of a quarter, to put it in perspective for folks at home.
Yes, it is. So.
And it's not something that we hear a lot about. You know, a lot of us go, I just had my 6-month exam and they actually checked for oral cancer, but it is so important, and especially in your case, you're a testament on catching it early and taking action right away.
Yes, it is very important. And whenever you go to the dentist, just ask for your oral cancer screening. So a lot of people don't even know what it is. So just ask for it, double check. And
it doesn't take long at all either.
It's
30 seconds usually.
Yeah, it's very easy. It's not an x-ray or anything. All they do is kind of
feel around
and kind of lift up your tongue a little bit. So it's really, really easy to do.
And you're taking action. You're actually going to sponsor a walk for others because you really want to raise awareness out there on something that we don't talk a lot about.
Yeah, because if it's going to happen to me, it can happen to anyone. I was in really good health. I had no risk factors.
28 years old.
28
very
years
young,
old.
yes.
Yes. So, yeah, I'm organizing a walk through the Oral Cancer Foundation. And so that'll be September 28th at Lake Surinsky. And registration will start at 7:30. You can go to the Oral Cancer Foundation website and click on events, and that will take you to awareness. And on the right-hand side, you'll see where our event is located.
And Methodist is actually going to be offering free oral cancer screenings at Estabrook Cancer Center, and UNMC is also getting on board. Yes. So a lot of hospitals just trying to raise awareness on something, again, that we don't talk a lot about.
Yeah, because out of all cancers, only 5% of cancers are oral cancer awareness, or related to oral cancer. So.
And you're a true testament that you weren't a smoker. You were at a very young age. You were in very good health, and this happened to you.
Yes. So if it's caught early enough, most cancers for oral cancer are caught at stages 2 or 3, or 3 or 4, and with that, the prognosis isn't as good.
Okay.
And so luckily enough, I was caught at a lower age or lower level, and had a really good prognosis.
And you look like you're doing great today.
I am doing great, back to 100%. So.
Well, congratulations, and thank you so much for sharing your story with us today.
And thank you for having me.
Well, still ahead, are you happy?